in a bid to reduce dependency on African countries on the global supply of vaccines and facilitate access in areas where the COVID-19 crisis has highlighted shortages. The Ministry of Health, in partnership with the Belgian Cooperation through Enabel, to contribute to Rwanda's goal of building a robust ecosystem in the biotech industry and to boost Rwanda's readiness to manufacture vaccines and other pharmaceutical products. This partnership aims at supporting ongoing efforts to strengthen the Rwanda Food and Drugs Authority through the provision of key laboratory software, and it is subsequent to the agreement signed between the European Union and the Rwanda Development Board, aiming to strengthen the capacity of the Rwanda FDA, which is the key to enhancing the attractiveness of Rwanda for future investment in drugs and vaccine manufacturing. Earlier today, my colleague Ethan Tashobia spoke to Dirk Depre, the resident representative of Enabel in Rwanda, to explain the significance of this partnership.
The actual intervention is in fact an EU-funded program, EU digital solutions to strengthen the resilience of education and health systems to COVID in Eastern Southern Africa and in the Indian Ocean region, where Enabel is in charge, in fact, of supporting the health sector in Rwanda. And this is because it's complementary to the bilateral program funded through Belgium, where we are already working intensively with the Ministry of Health and RBC since many years in supporting the health strengthening. Now, how this will help in accessing vaccines is maybe a complex question in the sense that the manufacturing itself requires different actors and it mostly a private business support. But what we do here now is, through our normal partnership with Ministry of Health and RBC, support the Rwandan Food and Drug Administration, which is the regulatory body, which certifies the quality of medicines and vaccines and other consumables in the health sector, in uplifting and reaching its maternity level 3, a maternity level which is in fact assessed by the World Health Organization. And the investment we're doing now with the EU funds are to support the IT system of FDA to align with the requirements of the WHO. So it's in fact a building block of the broader ambitions of the African Union and Rwanda to bring more vaccine manufacturing to the African continent, where strengthening regulatory bodies is one of the basic building blocks to be able to move forward.
How much has Enabel invested in this partnership?
Up till now, the first investment we have for the FDA is relatively limited. It's a bit more than €200,000. But in fact, the longer vision is to this is really strengthening the system. Is also on the IT development. Is once the software is functioning at the level of the Food and Drug Administration, further work with RBC and Ministry of Health to also connect the National Reference Lab and other laboratories. So we're eager to continue on this and seeing this as a first step in improving the quality control and certification of vaccines, but also the follow-up of the use of vaccines in health centers throughout the countries.
Okay, sounds interesting. Now, how long will this partnership last? And if you could tell us, besides boosting Rwanda's readiness to manufacture vaccines, is there any more that this partnership will deliver to, Rwanda, but also?
Well, as I mentioned, for us, this is part of the partnership we have in the health sector, where Enabel is being a partner for over 20 years. So we will continue in the health sector. I think as long as Enabel will be present in Rwanda, the health sector is really we have never left the health sector since we have been working together bilaterally with Rwanda. So I think it will be a long-lasting, continued relationship in strengthening the health system and the quality to health services for the Rwandan population. So we hope to continue this with RBC and MOH beyond even the actual interventions.
Mr. Dirk Depre, the resident representative of Enabel, Belgian Development Agency, many thanks for your time here.
Thank you very much.